Hey everybody, welcome back to the Outcomes Rocket. Saul Marquez here. Today I've got the privilege of hosting RJ Kedziora on the podcast. He's a co-founder of Estenda Solutions. He focuses on people and process management and provides strategic technical direction, guidance, and innovation insights, creating digital health solutions that improve patient outcomes, reduce cost, increase efficiencies, and improve patient and provider satisfaction. He has 25 years of experience in technology and he's won multiple awards, including the HIMSS Davies Award, and granted several patents. So excited to have you here on the podcast, RJ. Thanks for joining us.
Yeah, thanks for having me. Looking forward to our conversation.
Likewise. So look, we're going to dive into your company and the work that you guys do at Estenda. But tell us what got you into the work.
Yeah, I was fortunate early on in 7th grade, way back when in the 80s, my parents bought a personal computer for us and started programming. Knew going into college, I wanted to work in programming and software development. And so I got started there, and then through the 90s, worked through a variety of different companies. And then had, like many people, the desire, the entrepreneurial drive to start my own company. And had the experience of working in pharmaceutical and healthcare, and really found working in healthcare was a little bit better than all the other things. I've created the inventory management systems, accounting systems, railroad car scheduling systems. And it's great. They're all very important. You need to get, merchandise around. But in healthcare, there's always that sense of giving back, something a little bit more when you go to sleep at night.
Yeah, no, I love it. I agree. And I think everybody listening feels the same way. So definitely appreciate your reasons for why. And so talk to us about your company, Estenda. How are you guys adding value to the healthcare ecosystem?
Yeah, it's crazy. We just had our 20th anniversary last year. So to talk about Estenda and everything we do is probably a multi-hour podcast, but we focus on product development and data analytics solutions. We partner with companies in healthcare, hospitals, physician practices, insurance companies, and also industry, medical device manufacturers, creating innovative solutions, usually working with the R&D groups, sometimes the marketing folks when we're on the industry side. And then in healthcare, it's working with individual doctors, nurses, healthcare practitioners who have ideas of, okay, how can we change the current picture? How can we improve patient care? What can we do with this data? How do we find more data? Is our journey over these past 20 years. Just working with a large variety of companies, developing new innovative products, and been fortunate that some of those customers over the years have put our names, my name and other developers' names, on patents, because we've been so much part of that creation process. And then, as you can imagine, in healthcare particularly, it's one thing for a bunch of people in a room to say, oh, let's try this. You really need to get it out in the real world and make sure it works. So we actually have a couple PhDs on staff that can help drive those clinical studies as well to make sure that the products that we're developing actually work.
That's great. You guys make visions into technical working realities.
Yes, yeah, I like that. I start using it. It's been interesting, in those 20 years, it's been interesting because healthcare has always embraced technology, MRIs, all sorts of devices for diagnostics, but they're the last real industry to truly embrace the idea of data. Mm-hmm. And so that's one of those things we've seen in these 20 years. Just 20 years ago, it was like, okay, we have some data. How do we make value of this limited set of information? Nowadays, the healthcare industry is overwhelmed with data, between the Apple Watches and the rings and different technologies and the ability to get this information into the healthcare system. They're overwhelmed. So now it's not how do we derive value? It's like, how do we find the interesting pieces in that data and drive decisions?
That's awesome. Yeah, no, that's really good. And so for everybody listening, how would you position what you guys do better? And why, should folks consider working with your company?
Yeah, as I'm sure you and the listeners are aware, there are thousands of software development firms out there, hundreds that specialize in healthcare. We really focus on a couple things. One, creating value and reducing risk throughout the process. We are what's called ISO 13485 certified, which qualifies us for medical device software development. So if something's going to go to the FDA or European regulatory bodies for approval, we have the necessary certifications and processes in place to drive a product that is created with a high level of quality. But what that really means is SOPs, standard operating procedures, checklists, to make sure everything is at least thought of. You might decide not to do a particular thing at a stage in a product, but you're at least thinking about it. And so at a corporate level across the board from a product perspective, really focus on that creating value, reducing risk, and driving everything through checklists and things like that. At the individual person level within the organization, we do two things. We provide health medical education. So if you're working on a project in multiple sclerosis, we're going to provide some of that education. And there's just a plethora of information out there on YouTube and from Harvard, from Stanford Medical, from all of these institutions have put out this content. So it's very easy to acquire and use that content to help get our developers, the QA people, others in the organization up to speed in the area that they're working on, which has really been a benefit. And the second aspect of that is emphasizing empathy. It's a little hard to say. But empathy is a key to a lot of what we do in that education. Understanding what that patient is going through with a particular condition, what is their journey like? And also the healthcare professional. What is their journey like? How do they provide care to this patient? What are their challenges? So understanding that really helps us drive, unique, innovative, valuable solutions.
That's great. Thank you for that. And so you've been at it for, did you say 20 years? You guys have been in business for 20 years?
Estenda's been around for 20 years now. So.
Man, I mean, that's kudos to you, right? Because, the business statistics are not the best. Basically after 10 years, only 3% survive. And you've been at it for 20. So, shows you guys definitely have an offering that has stuck. You've added value to the industry. You've got your technical certifications in place. So kudos there. And as you look in the rearview mirror, what would you say is sort of a setback that you experienced that came with a huge learning that's made you guys even stronger?
Yeah, one thing to note in that 20 years of history, we also have some customers that have been with us for 20 years.
That's
a couple
awesome.
others that have been 10 plus, which is amazing. I think about lessons learned, and I go back to even before I started Estenda kind of thing. Early in my career, I'm working on some projects where we didn't have the right users involved. Even some projects early on in Estenda days, it's like you really have to question who is the user of the product. And in healthcare, you particularly have to think about that. So you're working with doctors, nurses, some PhDs necessarily. Who's really using the application. So you want to make sure that you have those people as part of the team. I alluded to very early in my career, developed a solution in a large enterprise to do complaint handling processing. And there was like 3 or 4 people that were really deeply involved, and they didn't want to involve those users in that project. And so as we were developing it, it was like, this just isn't going to work. So that was very early on, learned that lesson. And then just from a career perspective, also software development is, it's very important to learn and understand the technology. But when you think about writing software, you really write software very small percent of the time. A lot of the time you're reading the software you write and understanding. So the more that you can communicate to others and help others as part of the team understand what you're doing, the better off you're going to be. So I think about those two things a lot.
Yeah, no, that's really good, RJ. It's alignment, making sure you're aligning with the end user and then alignment, making sure you're communicating consistently about everything that's going on. I was having an interview, I think it was last week or the week before, and the physician that I was talking to is like, in healthcare, this seems to be one of the only places that people innovate and say, no, don't show it to the end user. It's like, why? And the analogy she used was like making a cake and it's got nuts in it, and then you serve it, and then half the people are allergic to nuts. And it's like, there goes half your adoption because you didn't ask them, when you could just ask them. So I think your example there is spot on. If you think about technologies and trends that are making a difference, making an impact today, what would you say one that stands out to you is?
Gen AI, the chat GPTs and everything is obviously making an impact, but I think of, and a lot of our work is in another area, and it's aging in the home and the ability to capture information and remotely monitor your patients. I think that's going to make a huge impact, particularly in the US as our population gets older and older. You don't want to take your elder parents out of the home they've lived in 50 years and put them into a long-term care center. They're just not going to be comfortable. Let them age in place, be where they are. And the technology exists today to be able to passively monitor and understand what's going on at home. They can wear the Apple Watch, they can wear the Ring, they can share that information with their caregivers, with their next door neighbor. There are devices that'll go under the mattress in your bed. They're like, okay, I know my father, my mother got up today, got out of bed. I know they opened the refrigerator door, to really understand what is going on. And if, they get up every day at 6 a.m. and make the coffee at, 7:30, and that pattern changes, the technology exists to then let you know, hey, they've diverged from their usual pattern. And maybe it's, give them a call, check in with them. How are they doing? So I think that's going to make a huge difference in healthcare and in just society in general as we move forward.
Yeah, I love that. Thank you, RJ. There's definitely big opportunity there. Nobody's ever comfortable, especially when you've been in your home for so long. Just going into a home, like it's the worst place you could be. And I agree. There's a lot of technologies out there. Sounds like you're working on many of them. And the Gen AI thing is also big. And folks, by the way, I was chatting with RJ right before we hit record. You're doing a webinar, right, RJ, on Gen AI. Talk to us about that. It's going to be in like literally tomorrow. So if you're listening to this, in the show notes, we'll leave a link for you to sign up, and so you could check it out and don't miss it. But tell us about it, RJ. Why should people attend?
Yeah, absolutely. And you can go to the Estenda LinkedIn webpage, and it's right there pinned to the top to be able to sign up for it. It's about using Gen AI in product development. So everybody talks about generative AI in terms of coding, software development, and it's very true, has huge use cases there. But there's so much more opportunity in using the generative AI solutions beyond software development, in figuring out what your requirements are for the software. What are the questions you should be asking? So Estenda's process is very template driven, checklist driven, but you can go into ChatGPT and say, or Bard or any of these other solutions, and like, okay, what are the top 5 things I need to consider when I'm doing X? And make sure you don't forget those types of things. But it can do that. It can generate data for you, generate test cases. There's just so many use cases for making your own process better and the product that you're producing better. So we're going to talk about that in a number of different situations.
That's exciting. So for everybody that has a software product, a lot of you, definitely check out RJ's webinar. We're going to link it up in the show notes so you could get access to that. Okay. So RJ, what would you leave us with closing thought wise? And the best place for, honestly, I think the call to action is go check out your webinar, but you know what?
Yeah. It's a good,
let's leave it at that, right? Let's leave it at that.
We're good.
And so what closing thought would you give folks? And obviously go check out RJ's webinar, but what closing thought would you leave everybody with?
and you'll see it in the webinar description kind of thing, but I've been saying a lot. There is some fear out there of people being replaced by AI in these Gen AI solutions. You're not going to be replaced by the Gen AI solutions. You're going to be replaced by the people using them. And that's the key. Like, you need to get out there and start experimenting with this technology. In college, I was actually going to get a PhD in AI, and then I got a job offer and went into the marketplace. And I've been playing in the AI space all of these years in various different arenas. But Gen AI is making a difference, and it's just going to continue to improve.
Yeah, no, RJ, great call. We won't be replaced with AI, but we'll definitely be replaced by somebody that's using it. So find out about it, get involved, do webinars like the one RJ is doing, download a course, start using it, like small use cases, get the paid version of ChatGPT and stretch it, find indications. It's a great call, RJ, and there's a lot of ways to do it. The main one is to go check out RJ's webinar. So we'll link that up. Check out the show notes below. RJ, appreciate you jumping on with us, and looking forward to staying in touch and looking forward to your webinar.
Sounds good. Have a great day.
You too.